I have had this question from so many mothers in my clinic, and they've always asked, "Doctor, why do I need antenatal checkups? When do I start the antenatal checkups? When am I supposed to start so?" You are at Doctor's Television with Dr. Kasireka, and now we're going to look at antenatal clinics or antenatal care. Antenatal care, before we go into there, hit that subscription button, click on that notification bell so that you will not miss out any video whenever we upload. Now, antenatal care is an attention or is a medical attention given to a mother who is expecting a baby or who is pregnant. Now, antenatal care is supposed to be given to all the mothers who are pregnant. That means that all the mothers have the right to access quality antenatal care. It is a right to every mother. Now, what do we do in antenatal care? What we do is assessing the risks and conditions, then also managing the identified risks or identified conditions that could affect you and your baby during the process of pregnancy, during the process of labor, during the process of after labor, what we call the postpartum. So when you have or when you attended to in the antenatal clinic, that means you will be at low risk of having a lot of complications during pregnancy, during labor, and after labor. So that is how important antenatal clinic or antenatal care is to a pregnant mother. We have seen mothers who come at the clinic when they are about 7 months of pregnancy. That is not right. It is a bad practice. But again, we realize that it is done because our mothers are ignorant. They don't know the right thing. They don't know what to do. Because they don't understand what antenatal care is and the purpose of antenatal care, then of course they come at any time. So we don't blame them. But we always educate them to come on the appropriate or at the appropriate time. So you will see and realize that whenever you go for antenatal checkups or whenever you go to the antenatal clinic, what the doctor does or what the midwife does, they order for a variety of tests. There are very many examinations that are done, and so very many other things. And you end up going home with some drugs. Those drugs are not for fun, but those drugs are to help you and your baby in that journey. So what we need to know in pregnancy is that when the pregnancy is still at 3 months and below, that is the very most important time, and you need a lot of attention because anything can happen during that period. And also it is that period that the baby is now getting organized and the baby or the fetus is getting formed. The organs are getting formed. That is how important that period is. So this period needs a lot of attention. It will need you to have some drugs like folic acid that helps you and the baby to have a proper process, if I have to put it that way, in a lay way. It helps your baby, or it helps in facilitating that process so that the baby will not be born with a lot of abnormalities or with any abnormality. There are some abnormalities that can be managed or that can be controlled when there is use of that folic acid that you get in the first 3 months of the pregnancy. So that means when you come at 7 months, you will have missed that folic acid, and then you're risking your baby to have some abnormalities. I think you've seen babies that are born with the intestines out. Babies are born with so very many abnormalities. Some can be controlled when you have this folic acid taken. It also helps the mother to have enough blood, because the mother or the child or the fetus is depending on the mother 100%. So that means that if the mother is not having enough blood, then the body of the fetus will not be well nourished. It will lack some nutrients that may cause abortions, those anomalies, and some other complications. So that's why important, you need to come at the right time. You need to start attending the antenatal clinics as early as you realize that you're pregnant. Even if the pregnancy is for 1 day, there you can start, or you're supposed to start attending the antenatal clinics. There are some other infections that can be tested and earlier detected. These infections can be or can cause an abortion, can cause abnormalities and very many complications to the mother or to the fetus. So when they are detected, when they are earlier detected, that means they will be managed at an earlier stage so that it will get better. The mother will get better before develops complications, or before the fetus develops complications. That is how important antenatal care is. So that means if you come late for the antenatal care, you will miss out those very many other things. So you need to attend antenatal clinics as earlier as possible, for as early as 1 day, or as early as you realize that you're pregnant. Then you're supposed to start antenatal care. Because when you start antenatal care, the risks and other infections or conditions that could have affected, or that could affect you and the baby, will be earlier detected and be earlier managed, hence minimizing the possible complications that would happen or occur during the pregnancy, during labor, or even after labor, that is postpartum, after delivery. So you see how important antenatal clinics are. Never hesitate to hit that comment section with your question wherever you want the clarification, or wherever you have a question that needs my attention. Please, always, the numbers are on my screen. You can give me a phone call, you can give me a WhatsApp message, so that we always keep in touch, because we need to know all this to minimize the risk and the increasing occurrences of the complications. So we need to know all this. Thank you so much for listening. You're still at Doctor's Television with Dr. Kasereka. Bye bye.